Okay. And I'm just wondering what you see for the future for, I know I discussed this before, but like when I first moved here, it was standard practice that if somebody had a positive, chlamydia test, for instance, my office would get contacted by the health department. They'd get in contact with the patient. She would be asked to give the names and contact phone numbers of her contacts, and then the health department would seek out those people. And that hasn't been done in a long time, and I'm just wondering if there's any.
This health department does not have the contract with the state for STI testing and contact tracing. We don't do that
Anymore.
Have not done it since
you've been here, for sure.
Yeah, since I've been here, and it was many years before that. And my understanding was that it was a group of nurses, and correct me if I'm wrong for those of you who were here, but what I have been told, not read, is that a group of nurses who were within our Department of Health, in fact, went out on their own in a different organization, competed for and were awarded that contract with the state. The health officer at the time was okay with that. Maybe not even did not even submit a application for that grant. And so that job is now done by another group. So we do not do STI testing here.
Is it actually being done? Because I'm not aware that anyone.
Yes, very much so. Yeah, the Olive Street Clinic, which is in Mishawaka.
Somebody's doing it, but I'm not aware that anyone's contacting my patients, for instance,
and then all that goes to, and I can't speak to how they do it.
Right. But they are privy to any positive test.
And well, I don't know if they are, or the reporting doesn't come to us. It goes to state, and the state would be responsible.
Yeah.
Yeah.
And they're required to report every positive STI that's on the reportable disease chart to NINCHIM or Olive Street, and their DIS, which unfortunately covers more than just our county, gets that positive result, and then they are obligated to follow up with those patients.
DIS being disease investigation specialist.
Yeah.
I wasn't even aware that was being done. I'm going to start asking my patients if they're getting phone calls.
Yeah.
Okay. Interesting.
AIDS Ministries, AIDS Assist supports them sometimes as well. Specifically, of course, if the individual is HIV positive, but we just talked with Leah just a few weeks ago about something. So
I should expect that my patients will get contacted by somebody. I can be telling them that. Okay. Thank you.
Two things.
Yep.
First of all, it looks like there's been quite an uptick in both abatement letters and garbage complaints and investigations. I don't know if that rides the coattails of the other legislative stuff that's happened here in our community, but I'm curious what that's all about. That's my first question.
Well, the garbage complaints, we of course have no control over. They're just the complaints that do come in, and they happen, and why exactly they're happening. There's a bit of an uptick. I don't think that our city and county is any less clean than it was in the last couple of years, but God only knows. In terms of the abatement letters, we're fully staffed within our environmental unit right now, and some of the more minor problems that we had, if you will, not been as attentive to in the past, we are more attentive to. In addition to that, and probably most significant for the increased number of abatements is that we used to be a bit kinder and sent letters saying, you really should, think about fixing this because we noticed it at time of property transfer, and we know it's not yet fixed. That rarely got a response, a corrective response, and so now and it took us time to do that, and we're just a little bit more quick to send an abatement letter and say, get it fixed.
Or else.
Abide by, the laws.
Ourselves coming to your house.
Yeah, I'm pointing to the guys who make the laws here. That's all I'm saying.
All right, my other question is about our our subsurface investigations, which is be our first spring doing those. And I was curious, as we don't have a track record of that historically in this county, what are we finding? Is this about as many as we thought we would do, more, less? Like,
I can
how's that going?
defer to Mark Espic to respond to that.
That's your lane.
It was really hard to anticipate, how we would use it. And it's being used a lot on property transfer. So we'll get an inspection in, it's incomplete. They could not locate the absorption area. I'll pull it up in GIS if I see streams or fields, where they could be tying into a tile, things like that, then we'll send it out there. We're using it more than I thought we would. And it's pretty handy. It's hard to gauge because I think we're the only health department in the country that has one. So it's really hard to tell, someone else is doing what we're doing with it. We have found so far 3 direct discharges into streams or ditches.
Wow.
So, I mean, it's paying off. It's only been a few months. So it's a great tool. We can see through concrete, asphalt. We're able to find whatever we're looking for. And you don't disturb somebody's backyard, so they don't have to mess around for weeks trying to get grass to grow again, leveling out their yard.
That's great.
That's great technology. Thank you.
All right. Anyone else?
One other question.
Yes.
I was just curious, the COVID testing at La Casa, it seems like there's a decreased number of tests that are being asked for and offered.
Right.
I guess I'm just curious. So do you have like a community health worker go out there once a week to, are they doing other things too, or they just sitting there offering tests?
They can participate in the social needs assessments there.
Okay.
And in addition to that, we did receive we received several thousand tests from the state, actually from the federal government, I guess. And so we're going to be distributing those to multiple different sites as well.
Okay, that's actually what I was curious about too, because I think if it's one day a week, you start getting symptoms and you're wondering if you have COVID on the day after.
Yeah.
You kind of need a test before the following week.
Yeah, exactly.
So people can maybe go to like La Casa and just pick up an at-home test.
We just
Is that the
received it.
idea?
We just received the tests
Okay.
a couple of days ago, actually, or late last week, I guess it was. We are working on a distribution plan that mostly is focused on anchor institutions within low-income sites.
Okay.
But we'll also make them available here, and we're going to make them available to all the community health workers so that they can then distribute them. And our plan is to allow them to distribute or encourage them to distribute to the tests come as if you will, 2 tests to a packet, if you will. And so they'll be able to give 1 packet per every household member.
Okay.
So if you have 5 people in your household, you can get 5 kits, which would be 5 packets, which would be 10 kits, 10 test kits. And so the hope is just as you say, so that people have them, and when they begin to get symptoms, they can test themselves early on without having to go to La Casa or anywhere else.
Right. Thank you, Dr. Bob, for that report. So moving on to new business, we've got Amy Ruby, who is going to talk to us about finances.
Yeah, and in your packet, you should have had a slide, which Jenny's going to pull up here, which does a comparison. The first one was done almost a year ago, May of 2021. And at that time, the only actual numbers we had were from the 2020 budget. The rest were estimates based on taxes that we received, fee revenue we received, and expenditures that we were going to.
On that little minus right there.
There you
That one? Yeah, we'll do it.
Still not that easy to see up there, but
Why don't you bring it up all the way up?
or with the-
Just hit this button.
Catch it with this.
Just for the record, probably the only time that you will see me make sure.
Tech savvy. So as you can see, with the projections that were done in May of 2021, it looked pretty grim come next year. We were expecting to be in the red with our fund balance. And as mentioned, only 2020 were actual numbers. The other three were estimates. Doing an updated version of that has changed the picture quite a bit. 2020 and 2021 are now actual numbers. 2022 and on are estimates. When I put in an estimate for the expenditures, that is what we are going to expect to request as our full budget. Granted, we never spend our full budget, but that is worst case scenario that it can be for that calendar year. Some things I want to highlight between each year, mainly on the updated version of May 16th. For 2020, our ask was $3.6 million. We spent $3.1 million. Most of that came back to us. We received some reimbursement from county auditor's office through the ARP funds for some of our staff that worked on COVID, our public health nurses, our health officer, our deputy health officer. We did receive some revenue back for those services. For 2021, we received more tax revenue and more fee revenue than what we had estimated the previous budget year. So that was an increase. We also have received back around $21,000 from our CDC grant that we put in for what we're calling salary recovery, staff that are working on the CDC grant that are currently funded through the regular county budget. Our ask for 2021 was $3.7 million. We spent 3.5. Our expenditures were lower than what were estimated, and we ended with a higher fund balance than was estimated. Going from 2022 forward, everything is an estimate at this point. For 2022, everything looks pretty much the same with tax, fee. Miscellaneous is a little higher. That is due to the salary recovery that we are doing through the CDC grant, as well as our TB elimination grant and our Trailblazer grant, where we do some salary recovery for staff that are currently on board. And of course, the COVID vaccination fee has brought in to date $1.6 million. That is the revenue that was generated from the clinics that we have held at St. Hedwig and now here at the County City Building. They are going to continue to send reimbursement to us. The only thing with that, we never know when it's coming or how much is coming. We just get a deposit in our account and are notified by the auditor's office. So we don't know when the next one's coming from the State Department of Health. We do anticipate, of course, a large fund balance after this year with the additional fee from COVID. And then going into 2023, we are expecting to ask for a 5.9% cost of living inflation increase for all of our staff members. Going forward, everything is laid out as an estimate, just doing a 3% increase for staff going forward after 2024. And this will take us to sometime in 2028 where our fund balance will be in the red.
Any questions? That's certainly a different picture.
Could you tell me what that cost of living increase for this year was again? I didn't hear it.
For 2023, we're going to ask for 5.9%.
5.9%. Okay.
Yes.
Thank you, Amy, for putting this together and staying on top of all of this and explaining it to all of us in a way that we can understand. Totally appreciate it. What questions does anybody have for Amy?
So on the cost of living increase, when will that happen for staff?
That'll be January 1st.
January 1st, okay.
But if it happens,
Right.
We're gonna
That's
ask
what we're
for-
gonna propose to the Finance Committee of the Board of Health. And then the full Board of Health approves that, and then we submit it to the auditor's office and go through the budget cycle. Which we do have a short turnaround this year for the submission of the budget. I'm hoping to have the Finance Committee approval before the next Board of Health meeting, so it can be approved at that Board of Health meeting, because I do need to submit it just a few days afterwards down to the auditor's office. So I'm planning on that being on the agenda for next month.
So it means Finance Committee needs to be meeting rather quickly. I will get with Jenny so we can get that scheduled. Okay, awesome.
If I could point out, every time she said salary recovery, talked about 3 different grants.
Yes,
Basically what she's talking about here, I just want to make sure it's clear. These are extramural dollars coming into our county, and then meaning that that our own county tax dollars are not having to be used for these expenditures.
that's when we see your name like listed on a CDC grant, for
Like
instance.
CDC grant provides salary recovery.
Aside.
Right.
Awesome.
Which are things that will sunset eventually. And that would hasten the drive towards the red eventually as those grants would end.
If we don't have further grants, but the whole, the idea here is that we'll continue to be entrepreneurial. I mean, this is the expectation that I have set for the team, and I expect all of us collectively to be looking for extramural grants from a variety of different places. If that doesn't happen, then you're right. Then it would just be back to business as usual as it was over the last 25 years.
Awesome. Any other questions? All right, hearing none. Thanks, Amy, very much.
Thank you.
All right, next up on our agenda is Sally Dixon is going to talk to us about the birth equity report.
I'm gonna scoot up here a little bit. Okay, that way everyone's on. Because I can only apparently see the slides now, that I'm so dependent on them. It helps visual, I think. Thanks. Yeah, I'm Sally Dixon, and if you don't know me, my background is I'm an RN, labor and delivery, postpartum in a former life, and I've been at the department 6 years now. Now as the coordinator of maternal and infant health initiatives, and this is our little diagram that kind of explains where we're taking action to decrease infant mortality. So, and how they all interact: systems, policies, institutions, providers, women, families, and communities. So almost everything includes overlaps into those areas. And so that includes the fetal infant mortality review, our community action work groups, maternal infant preconception health, where we talk about things and produce educational items on safe sleep, women's health through the life course, and then our birth equity and justice groups that we have a legislation and policy committee and our community engagement committee. And then I do things like we have some other projects going on where I'm meeting with like practice managers from pediatric and OB provider groups to share all the things that we're doing and resources that are available to them, and to connect them to community-based organizations. And then we have a partnership going on with Women's Care Center, where we have a community health worker embedded there to help facilitate insurance navigation, connection to resources, and then clinical prenatal care sooner. So. And then these are all of our different community partners. We've got lots of them. I always say I'm probably missing some. I need to update that slide, but we want to be the best place to have a baby in Indiana. So, but I'm mostly talking about our birth equity events today that were in April. And so this is our 7th year, and starting utilizing the stories of infant and fetal loss and interviews with families. And that's what informs, all the work that we do, and giving voice to parents' experiences. So the fetal infant mortality review, from all of our data and the stories, we come up with recommendations. And so the birth equity events were based on this one, where we want to eliminate racial, ethnic, and socioeconomic disparities in birth outcomes. That's kind of the umbrella over everything. And this is the reason why. That's the picture of why. You've probably seen this before when I've been here, but the blue line is the Black infant mortality rate, and it remains almost 3 times the white rate, which is in orange there. And you can see it has come down a little bit. The first number in 2016 when we started was 19. Likely the biggest reason for that is Medicaid expansion, which really improved insurance coverage for women. It went from 21% uninsured childbearing age to 11% within a few years after Medicaid expansion. So I'm going to skip these slides. So Heidi, I will stay on time. So the main thing though is we have to get rid of, Dr. Arthur James calls it the survival lag. And if we keep doing the things the way we've been doing them to decrease infant mortality, which is largely focusing on individual like factors like smoking and things like that. Not that that's not important. It'll take too much. It's just going to really come down too slow. So we've committed to achieving birth equity, which is assuring the conditions of optimal births for all people with a willingness to address racial and social inequalities and sustained effort. I also think about it, it's kind of like a math problem. We have to focus where the higher rate is. And so the optimal conditions include everything from economic development, social well-being, those social determinants of health. I'm sure you've all heard about in other contexts from our staff. So a lot of this is shifting accountability and exploring our roles as providers and caregivers, hospitals, institutions, and the people in power that can change policies to make change. And if we do that, if you do the math and the cases where we thought had some good chance of prevention, we really will decrease the infant mortality rate. We have the potential to do it. So
I'm sorry, nobody on Zoom can see any of what you're talking about.
Oh.
None of the slides are moving. It's still stuck on slide 1.
Oh, sorry, it's moving here. So I don't, let's see,
Not sure, can we fix that?
we'll see if we can fix that. We will. I usually would have to do that. That's funny. Yeah, because they're moving here. Well, they're looking to see. That's odd. Usually if it's moving, let's see what.
Screen shares.
If they can't see the slide.
But you can see the first slide?
Yeah, I can see the first slide. I can see everything, the cursor and everything too, moving across the screen there. But that was it. Could only see that slide. And you guys were fine. You guys were all moving around in your box window, whatever.
That's weird.
Hold on, let's wait. Robin's on it.
Zoom, it's so good, but yes.
I know, technology. Oh, well.
Yeah, so if you move through this page, were you on a slideshow?
Yeah,
Before?
we still are.
Yeah,
on
we just didn't see the slideshow is what was going on. I could see this page, that was it.
What do you see now?
I see birth equity and justice.
Okay, thank you. But hold on, I don't think so. Hold on 1 second. Sally, click it and see what it does.
Yeah, it's not going forward.
So it's not advancing.
Yeah, it's a PowerPoint issue.
Oh,
I think for Zoom, I think the internet's lagging. Hold on 1 second. Well, I think.
Is that your last slide?
no.
Robin, could we just advance it for her?
Yeah.
Yeah, that's true. I mean, I don't know, there's not a ton more. I mean, they're just, it's just something to look at.
Yeah. Well, it is helpful.
I think so.
Oh, there you go.
What can you see now? Can you still see birth equity and justice?
Yeah, and the cursors, oh, now it changed to the sponsors.
Okay.
Okay.
Thanks,
We're good.
Now is it working when okay, let me see when I do it.
Yeah, it's working.
Yep.
Can
Okay,
you see sponsor,
okay.
not birth
Yeah.
equity?
Okay. So anyway, from the earlier slide with all of our partners, that's where that group of happens to be all women comes from in the community. And so for the events, which I'll talk about in a second, we were just, overwhelmed with the amount of sponsorship and support for this effort, in our invitation to them, explaining what birth equity means and about the racial, ethnic, socioeconomic disparities in birth outcomes. And so every health plan sponsored us, Martin's Grocery, so colleges, the American College of Obstetrician and Gynecologists, nursing organizations. So That's pretty cool. So the two events, the evening event was focused on obstetric pediatric providers, elected officials, and community leaders. We had, I feel like I skipped I did do the thing about birth equity. So both events had our keynote speaker, Dr. Joya Perry from the National Birth Equity Collaborative, and then we had local physicians and people talk, and then Kara Herring from the Chief Equity Inclusion Opportunity Officer from the state of Indiana wrapped up the evening event. So we had 60 attendees for that, and that wasn't meant to be as big of an event. And then the conference the next day was more catered more towards people who care for mothers and families. So nurses, social workers, some physicians were there, some health plans. We had all those sponsors, had a lot of vendors. And then this was really focused on how to look at your own practice and your own place of work and how you can improve things to achieve birth equity. And we had breakout sessions. It was a full day conference, and the sessions were based on our other recommendations from the FEMA team. So, and we also had the maternal mortality review from the state come and present. We talked about maternal mental health, partnering between clinical settings and the community setting, and then screen the movie Toxic, A Black Woman's Story. That's about just the lived experience of Black women and how that stress can contribute to higher rates of prematurity. And so we sent out evaluations, and as often happens, I think, I don't know, maybe got back maybe a little over 10% of them. All of them were pretty positive, real positive. We didn't really have any negative ones. I feel like that's good because, you know, if you're going to fill out an evaluation, you do if it's negative. But yeah, the only little negative thing was lunch took too long, but because it was buffet. So we have our next meeting next week to kind of go over like lessons learned, what we're gonna do next, and what we really want to move towards more community-based with moms and families, and listening to what they have to say. We do that with the case review team through maternal interviews, but now the more the general community. And so, but the one big thing that we did do the following week with National Birth Equity Collaborative, who we're doing a birth equity assessment with, we had a big partner kickoff with a lot of those partners you saw on the screen to participate in this assessment and then strategic plan. And so I won't spend a lot of time on these, but the you know, what they normally do is work with one organization, but because we work with so many organizations to try to achieve this goal, we're including everybody. And so where we are with this and what it entails is we did a lot of pre-assessment work where they looked at our reports and what we've been finding with our fetal infant mortality review. And so now they're conducting partner surveys. They're going to do staff surveys. A lot of our partner organizations have their own efforts on health equity. And then we'll get all the way to doing community focus groups to develop an assessment of where we are and then a strategic plan about how we're going to get those numbers where they need to be. This one doesn't matter. So that's really our next steps is continuing to do that work together.
Wow. What questions do we have for Sally about the birth equity conference and the work they're doing on birth equity?
Well, I wanted to make, I had a few questions about how the county is partnering with the NBEC. So it sounds like, are you saying the NBEC is, I'm correct, that sorry, that was my phone, which I didn't. The NBEC, the
National Birth Equity Collaborative.
Yes, so the founder was the person who spoke at the conference, correct? Okay, and so the organization, they're coming in, and are they the ones doing this like pre-assessment and giving the survey and doing the focus
So
groups?
it's kind of an evaluation of
Okay.
how we are, I guess, in a way, it's like, how are we living up to the goal of achieving birth equity? Like, what's going on in our community when, I guess it's like, well, how are the different entities considering the factors that contribute to to the racial ethnic disparities.
Okay,
And so the way we were working with them is we applied for a grant. We have a grant from the Community Foundation of St. Joseph County
Okay.
and Indiana Minority Health Coalition to work with
Okay.
them.
so we're paying the NBEC, but it's through these grants that the health department got from the Community Foundation and from the
Indiana Minority Health
Indiana.
Coalition.
And how long are these grants for? Is it like a
So-
3-year grant or?
So it's for the duration of this process, which
Okay.
was delayed. I think the grant off the top of my head, we may have gotten the grants in like 2020. So a lot of
Okay.
it was delayed with COVID.
Yeah, I guess it would be.
Yeah.
Okay, okay, so how long is the whole process supposed to be?
So based on that timeline, it looks like by the end of the year is what we're predicting.
Oh, okay.
Yeah.
Okay, and then is that like the end of their involvement and then you just kind of take that information and
I think
figure out what
so.
to do with it?
Yeah.
Okay,
So then we'll have a plan.
okay, 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 okay. So the health department's kind of spearheading it, but then you're also bringing in other groups like hospitals and local community action groups and things to kind of.
Because we know that it's not just the health department. We don't have our own maternal child health, like where we're directly serving
Uh-huh.
mothers and families. So we work with everybody to do that.
Okay, okay, okay. Great,
Do other board members have questions?
Sally,
Just
I have
make
a-
sure.
I have a question. Can you talk to us about how you go into, like, what kinds of things you say when you go into like different OB groups, for instance, in town and talk with the physicians there and their practice managers to give them insight into, the data that you have and how we can make a change for the
So,
better?
okay, so thank you. That's a good question. So what I do is usually presentation with some data. So, what the infant mortality rates have looked through from year to year. And then based on all of our work with the case review, we've been able to, we know what the different causes are. Then we can look at what are the different areas that would make a difference. And so things like not just access to prenatal care, but what's happening when someone's in prenatal care, or their blood pressure being treated? Are they if somebody comes into the hospital and they have symptoms, are they being listened to, or they get sent home 3 times? Do things sometimes get missed? So I guess what I want to say is, like, our whole goal would be when we review a case where there's an infant loss, we know they're not all preventable. What we have found through the process is that about 55% of the infant and fetal loss, I'll just stick with infant for today, but infant loss for the last 5 years had some good chance of prevention. That could be something like access to care prior to pregnancy. It could be something that happens along the way during the pregnancy. And so trying to really inform everyone what we're really seeing, because sometimes there's assumptions that it could be drug use. We haven't had a case with where opioid use was a factor since 2017 for an infant loss. So a lot, or with safe sleep, sometimes the assumption might be that people don't have, a place for their baby to sleep, but in most of our cases, we find that they do. So really trying to get accurate information so that the education they're providing, what they're looking for, is going to help. And then also from the side of when we're talking about equity and racial equity is really tending to and thinking about where bias might play a role in care. So that's, yeah.
Thank you. Are there other county health departments in Indiana or maybe in other states or other departments that have been implementing this project, this survey? Do you have any indication of how that's gone and what they've done with this information? Or are we kind of one of the first?
I think in our state, we would be probably the first.
Okay.
This is something we really made a priority based on our numbers. So it depends. So that's the thing about FEMA, depending on what community you're in, like what is the biggest issue. We have samples and of what the kind of report looks like. And of course, everyone's plan will be different based on, that different community and what the input from all the different partners.
Okay. So how did you, other people in this department find out about this group?
So, I mean, I can speak for myself. So starting, I guess, in 2018, I started attending City Match conferences. It's a maternal child health conference, public health conference. And I guess I can only speak to my own process along the way here, not knowing about health disparities. And so seeing different speakers, learning about who's talking about this, what do we do about it? And then I think that it's hard, it's like, how do you figure out?
Yeah.
I'd have to look back through all the minutes, but that's part of it. It's just being exposed to, different speakers, different articles, different, journal articles, that kind of thing. So, and it really does just follow the overall principles of health equity, but specifically for birth and what we're finding in higher rates for maternal and infant mortality.
Does this group work with fetal, right? Because I know it's both a fetal, stillbirths and infant mortality. Does this group work with reducing fetal mortality or just infant mortality?
I would say it's maternal, fetal, and infant.
Okay.
And I mean, and I'm guilty of not always giving attention to stillbirths too, because it's a little bit different. I mean, the factors are similar in fact when it comes to access to care, quality of care, and that kind of thing. But yeah.
And Ellen, in our FEMR board, we do review fetal and infant mortality cases equally as they come up.
Okay.
Review all of them
And
as
so,
they come up.
and just for clarification, fetal is 20 weeks on,
20
right?
weeks
And
on.
a stillbirth. Okay.
Yep.
But it happens inside though.
Yeah.
Before birth.
Okay. Yes.
And then
All right.
infant is really is considered any live birth at any gestation. So even before 20 weeks, if there's signs of life,
Yes.
then that generates a birth certificate and a death certificate.
Yes. Yes. I think you told me that before, but that's great that it's
I know.
on the record in the conference.
Yes. So, and of course, like the maternal, you can't separate maternal health from infant health, women's health. It's all connected. So,
Thank you.
good. All right.
Thank you.
All right, moving on to old business, which we have none. So agenda item number 8 is board notifications. We had a hiring, Sarah DeCruz with food services as an administrative assistant. And Nancy Pemberton, we wish her very well as she moves on to the next chapter of her career in life. So moving on to public comment, I didn't say this in the beginning. If anyone here is wanting to engage in public comment, to please sign up on the clipboard. And then I will ask Jenny if we have anybody who has signed up on the clipboard.
We have Cynthia Heckerman Davis.
Wonderful. Cynthia. Yes, please. Doctor, yes.
I'm just going to stop sharing that.
Okay. During public comment, each person has 3 minutes to speak. And I'm supposed to read a little some somewhere. There it is. At the regular meetings, the public is invited to address the board for 3 minutes regarding items posted or not posted on the agenda. Individuals may only speak once during this section of the agenda. Speakers shall properly identify themselves by stating their name and address for the record. Personnel issues are not to be addressed during open sessions of the Board of Health. The board president may interrupt, warn, or terminate any person's statement if the statement should become personally directed, abusive, obscene, or inflammatory. And I'll keep time, and so I'll let you know when 3 minutes are up. So please, you can stand or, go ahead.
Cynthia Hickman Davis. I live at 125 Gemini Lane in Walkerton, Indiana. And I attended the Birth Equity Conference. It was excellent. I saw Dr. McLeory there, and I think Dr. Ryan.
Mrs. Rylander.
Mrs.
Law degree.
But it was an excellent conference. It's very, very necessary work that Sally Dixon is doing, with Indiana being, depending on which survey you go by, either 47th or 48th in the United States lagging behind most other countries in fetal infant mortality. I am excited to see this program going forward, and I'll be very interested to see what the plan is to help make our prenatal care, even preconception health needs to be improved. I was reading a study about, this is an IU study that was giving out blood pressure cuffs to their prenatal patients. And they would take them home and check their blood pressures. And of the ones that checked and actually got back, about 11% actually had a high blood pressure reading that was not otherwise picked up on the prenatal visits. So it's going to require a lot of creativity, thinking outside of the box. In order to move this forward, we can't depend on just our Department of Health to do this. It is going to be a community-wide effort. The residency programs, I think, should get involved with our residency programs to help this be a success. Thank you.
Thank you very much.
That's
you, Jason.
That's right. Oh, you're already up.
3 minutes, please.
I forgot. I didn't know to sign in. My name is Marla Godet, 55705 Sichuan Drive, Osceola. I want to say thank you to the Health Department for their support with the Achieve Birth Equity Conference. It was fantastic. I've been getting calls consistently since the conference saying that people were excited. They were appreciative of information that they didn't know. Men have been calling me saying, whoa, I did not know that, you know, my spouse or my partner had the possibility of dying. And so I just thank Sally and Kelly for inviting me into the work, Dr. Kirsch for all of her wisdom and advice. And most of all, I thank this health department for saying that racism is a health crisis. And when I've talked to other cities and I've met with people, I just did a training on maternal care and marijuana in CAS. They don't even have a birthing hospital. They don't have an OB-GYN for 100 miles. They have to go to other counties. They have zero. And when I told them about our work, they were just amazed. They couldn't believe it. And they want in. They were like, what can we do? Invite us to everything you have. So I said, I don't know if we're doing anything else that day, but they just want information because people don't, I couldn't believe you don't have an OB-GYN in your whole county. And so I'm thankful that we're taking steps to reach out and to service the maternal care and the infant care and maternal, you know, all of it. So thank you. And I appreciate St. Joe County Health Department for stepping up and saying we got to do something to protect mothers and babies.
Thank you. Thank you. Jenny?
Marilyn Gashaw.
I'm coughing a lot. I don't have COVID. I'm having a reaction to the medication. But I just have one quick question because all of this is new to me. What do you want the community to do? Or what do you want of the community? Because I'm looking at numbers that are appalling to me and that have been pretty high and for years. So if you want the Black community to participate in something, let us know.
Absolutely. Are you talking to me?
I'm talking.
I was gonna ask the same question.
And we've done that a little bit. We've done that with, we invited some, we had some first ladies of the church come to something about this topic and visited church. So make sure I have your name.
Okay, because I'm not affiliated with the church.
You don't, no, you don't,
But just
that's
the
fine. Because that is
community.
what, and what I was talking about, that is next.
Okay.
Is, and we wanted to be able to do that. And when we're ready to talk about that, so we know what we're talking about, and we want to, yeah, we want to do something we've been talking about where we want to come and listen to other people's experience. So before you go.
Thank you. All right, so that concludes public comment, and our next meeting is on June 15th at 4:30.
No, I had public comment in here.
I'm sorry, we're not taking public comment via Zoom. You may
Oh.
submit a comment through email, or of
Okay.
course through mail as well, but
Yeah,
email.
well, I mean, I'll be doing that, you know, obviously you all know I'm a journalist and I just want to know who did any investigation on Career Perry, because she has been accused of killing a baby, her mother, she had her license suspended, she was practicing without a license.